Good afternoon, good morning, and welcome everyone. It is my pleasure and privilege to welcome you to this important webinar, launch of the Strategic Program Framework on Strengthening Civil Registration and Vital Statistics in Eastern and Southern Africa. My name is Isabel Magaya. I'm from the African Child Policy Forum, and I have the honor of moderating today's conversation. We're gathered here because we all believe in something fundamental. Every child matters and every child must count. Yet across our region, too many children remain invisible. They're born but not registered. They exist but are not recognized by law. So the consequences are profound, and they have a strong effect on children's access to education, healthcare, protection from exploitation, and even their ability to participate in society. Civil registration is not just a technical process, it is a lifeline for children. The right to have one's birth registered is a gateway right. It opens for children to enjoy their other rights. So protection and dignity are also fundamental aspects of children's rights in this regard. The strategic framework we are launching today is more than a roadmap. It is a rallying call for collaborative action across governments, regional bodies, and development partners to close the identity gap and build stronger, more resilient CRVS systems to leave no child behind. Over the next 90 minutes, colleagues, we will hear from our distinguished speakers, practitioners, policymakers, and child rights champions who are at the forefront of these efforts. I invite you to engage actively, reflect critically, and most importantly, to think about how we can work together to translate commitments into concrete results. Bios are in the chat. The bios of our esteemed distinguished guests are in the chat. Please go and look at their bios. And if you have any questions, type in the Q&A section. And also don't forget to specify which of our distinguished panelists should respond to your question. And the webinar is being recorded, so you will have access just in case some of you have to leave before we finish, or you'd like to share the insights that would have been shared in this webinar. You will be able to access it. It will be recorded. With that, let me warmly welcome our first speaker, Alison Parker, the Deputy Regional Director of UNICEF ISARO. Over to you, Alison.
Thank you very much, Isabel, and I hope everyone can hear me clearly. Representatives from the African Union, regional and sub-regional bodies, government representatives from across East and Southern Africa, distinguished guests, distinguished panelists, ladies and gentlemen, and colleagues from across the continent. Thank you so much for joining us today. It is my honor to join you all to launch our region's strategic program framework for strengthening civil registration and vital statistics in Eastern and Southern Africa, a framework that signals a renewed promise to every child, the fundamental right to legal identity from birth. As many of you know, civil registration and vital statistics systems are the backbone of national identity, inclusive governance, and public service delivery. Yet today, in our region, the statistics are stark. An estimated 61 million children under 5 are without a birth certificate. 48 million are unregistered children, and 13 million have no proof of registration. And this is based on what we know. This means there are millions of children grow up invincible, invisible, unrecognized, stateless, excluded from education, healthcare, protection, and ultimately the opportunities we also crave. This framework therefore responds to this urgent reality. It is not just a technical plan, it is a decisive shift from systems building to an inclusive design, resilient in the face of crisis and responsive to the needs of every child, no matter where they are and no matter their circumstances. It sets out a bold agenda for us at the regional level to tailor approach for closing the birth registration gap and strengthening civil registration systems across 21 countries in Eastern and Southern Africa. At the heart of our discuss today are 3 practical accelerators for real change. The first is the interoperability to connect civil registration and vital statistics systems with national information systems. We realize that we duplicate efforts across our various social networks, and it is important at this point, how do we bring in our civil registration into health, education, social protection sectors so that we ensure that no child falls through the crack? We have evidence of using health touchpoints such as birth, immunization, and maternal health as key entry points for civil registration. And we've seen significant spike in registration in those countries, who I'm sure are going to share their experiences. Decentralization is pivotal. Bringing the services closer to families, especially in rural and underserved communities, is going to be critical. The out-of-pocket cost for identity, which is a fundamental right, has to be reviewed. Our legislative frameworks have to make sure that the most vulnerable can have access and it's affordable. The third key area is digitalization. And I'm sure a lot of us have spoken to that, but modern systems enable real-time data exchange and ensure security and sustainability. They also ensure that the most vulnerable families and children can interface with the system just once. They don't have to enter the system 6, 7 times. Just having their identity registered once, they can access all the services that they need to grow and develop. This framework is firmly anchored in global, continental, and regional commitments, from the Convention on the Rights of the Child to the Agenda 2063 and the UN Legal Identity Agenda. It shows that we are just building on what has been established over the years. It also aligns with UNICEF's strategic plan and the Africa strategy, recognizing birth registration as both a legal entitlement and a foundation for human capital development, inclusive governance, and equitable service delivery. But we know that technology alone and technical solutions are not enough. Today, we really want to make a call that as we push to achieve universal birth registration, it demands political leadership, domestic financing, strong intersectoral coordination, and above all, community trust. It also requires deliberate action to remove legal, gender, and social barriers that keep the most marginalized children invisible. This must be our shared call for action to ensure that no child is invisible, that no birth goes unrecorded, and that every life begins with recognition, rights, visibility, and dignity. Because when we register a child's birth, we do more than a certificate. We affirm their place in society, their contribution to national development, and an accountability to each and every one of us. Together through this framework, we have a real opportunity to shift from narrative and fragmented efforts to unified systems, strong policy commitments, and concrete action. Let us be the leaders on promise for legal identity for every child everywhere. I thank you, and I look forward to the discussion.
Fantastic. Thank you so much, Alison. Thank you so much for setting that scene for us. Next, on our panelist, we have Mr. Timothy Ekesa, a member of the Committee on the Rights of the Child. Over to you, Timothy. You have 10 minutes.
Thank you very much, Isabel, for the moderation. I hope you can hear me, all of you.
Yes, we can hear you loud and clear.
Thank you very much. Yeah. Distinguished fellow speakers, organizers of this important webinar, experts, and practitioners who are following the discussion. On behalf of the 18 members of the Committee on the Rights of the Child, we really feel privileged to be part of this webinar, speaking to a matter that is very close to the heart of the work that we do. I'll share a few slides on the position of the Committee on the Rights of the Child when it comes to issues of birth registration. I'll just speak over the slides. But before that, I think it's important to just inform members that I work in the children's sector. I work for an organization that works for children. And I just did a small brief over there for members to know that we are a membership organization and most of our members are joining us on this webinar. We also have status with ECOSOC, the UN, and observer status with the Committee on the Rights of the Child, and also members of the Global Movement for Violence Against Children. And more importantly, members of ECPAT International, representing the country. When it comes to the reason why I'm here on this webinar is just to say that I'm speaking on behalf of the Committee on the Rights of the Child. Is one of the 10 committees of the UN treaty bodies. We work across many other committees, but I think through the CRC is where we speak more about children, but we do cross work of CEDAW and work with also CRDP, which deals with disability, among other committees and even the human rights committees. And I've just shared the number of the membership in each of the committees, which cut across a lot of work that we are discussing here today. When it comes to the issues of our and vital statistics, I want to say that as a committee, we actually have a whole dedicated cluster. Is the cluster on civil and political rights, which looks at Articles 7, 8, 13 to 17 of the CRC. And it's dedicated on issues of nationality, issues of birth registration, right to identity, freedom of expression, access to appropriate information, among other items. From the CRC perspective, we look at birth registration as a core foundational right for every child. And it's important for every child to acquire registration immediately after birth and also acquire nationality. And this is also emphasized in the Article 6 of Part 4 of the African Charter on the Rights and Welfare of the Child. We also work at ensuring universal registration and prevent statelessness. That's one of the key things that we have in our general comments and periodic reviews. There's a lot of stress on the whole issue of universal functional civil registration, especially in the areas that have a big problem, the sub-Saharan Africa where we are. The committee strongly recommends state parties to adopt or reform civil registration laws to ensure coverage, accessibility, and legal completeness to prevent statelessness. And I think the other third bit that we deal with is ensuring that comprehensive national strategies towards 100% registration are implemented. I think that's the whole issue of achieving universal birth registration is a key point that we work with as a committee. I'm just going to share a sample of 4 countries, and in very brief or exactly because periodic review is one of the key things we do as a committee. And every time the comes and to 5th State Party Report of Tanzania, there was a lot of challenge of reporting on law, birth registration. There's also high cost. And there was the committee made particular recommendations, which are actually speaking to the meeting of today, the whole issue of free birth registration, decentralization, retrospective or late registration without penalties, and also public awareness. And I think one of the biggest things that was recommended to the Tanzanian team by then and in 2012 was that the state party needs to establish permanent, accessible, and affordable mechanism for birth registration. And we are hoping that as the delegation again comes to the committee, likely in January, they'll be able to give us an update of what they have done after they submitted their 6th report, which is under review as we speak right now. In DRC, there was a whole recommendation on the issue of decentralization and accessibility, just like Tanzania. And again, in their report that they submitted to the committee in 2017, there were issues that were being raised, especially there was very extreme law registration. And the other big challenge, especially in the conflict areas, there are many children who are not being registered. And I think the biggest recommendation, again, we made to the country, Democratic Republic of Congo, was to ensure that birth registration system remain accessible. They still remain inaccessible to children in rural areas, and especially for undocumented parents. So this is an area that, again, we are hoping that the committee will be able to work with the committee, the country when they come to make their presentation. Kenya,
You have 4 minutes
when they made
left.
the report in 20...
You have
Sorry?
4 minutes left, Mr. Ekesa.
4 minutes left.
4
Yeah,
minutes.
I'll just run through the slides because I'm running with a few slides to be able to come to the end. Kenya, again, I want to say that the recommendations that were made on the committee, there was a big issue when it comes to the Nubian children, refugee children, and the Makonde children. And this has already been addressed because it was a big recommendation which was made by the committee when they appeared before the committee in 2016. Then finally, Zimbabwe, there was a big problem on late registration, and they have not made their report actually they have not made their report recently. So there's a lot of work that we still want to get from them. Overall, I just want to say that the key common thread in all these reports is that there's a lot of emphasis on the issues that I've just mentioned out of universality, the issue of decentralization and public awareness, and also technical support that is supposed to be given. As I finish up, I just want to look at the place of birth registration on the General Comment 27, which is still a draft comment. And I think one of the key things with that comment, which was just made 2014, is that we are saying that birth registration is a fundamental human right. And we're also saying that there is a lot of birth registration is essential for protection of all children. And the whole issue of ensuring that there's a lot of consultation on this GC. And I'm happy that CHIP was one of the partners that gave views, and even children, over 7,000 children, were able to be part of the consultation that brought up this general comment, which is very important and is still being under work. Then finally, I just want to say that in conclusion, the CRC underscores the whole issue of birth registration, and it really urges states parties to establish universal birth registration and have institutional framework that can be able to address the 4 issues that we are dealing with today. And the committee strongly supports the work of the strategic program framework because it is fulfilling some of the obligations we have as CRC. Thank you very much. And thank you for listening to me. And we hope to continue getting ideas and also your feedback on what the committee is doing. I thank you.
Thank you so much, Mr. Timothy Ekesa. Ladies and gentlemen, that was Mr. Timothy Ekesa representing the Committee on the Rights of the Child and the work on the importance of birth registration. Thank you very much for sharing those insights, Mr. Ekesa. Now over to our next speaker, a colleague and a friend, Honorable Karuna, the Special Rapporteur on Birth Registration, Name and Nationality in Africa, representing the African Committee of Experts on the Rights and Welfare of the Child. Honorable Karuna will be speaking to us on the importance of the subject matter in discussion, including the general comment and the current report by the Committee on Digitalization. Over to you, Honorable Karuna. You're muted, Honorable Karuna. We cannot hear you.
Hi, it's okay, Isabel? Right now?
Yes, loud and clear, loud and
Yeah,
clear.
I was saying I was thanking you for welcoming me in that laudable, webinar, which is about the development of a strategic program framework on strengthening civil registration and vital statistics in Eastern and Southern Africa. Actually, distinguished representatives of organizations working for child identity protection, abled practitioners and speakers, ladies and gentlemen, and also our children, our African children. Good day, good afternoon, wherever you are. And of course, thank you for your presence in this, this laudable webinar. Without further ado, because I have to rush with time, so I will start my presentation, which shall comprise inter alia the current status of digitalization of birth registration, emerging trends, opportunities and benefits, challenges and risks, and also key recommendations, right? If we go with the current status of digitalization, Initiation of digitalization, you will all agree with me that African countries are at various stages of adopting digital technologies for birth registration, often transitioning from manual paper-based system to hybrid models or fully digitalized platforms. For instance, we have Nigeria, which has launched its electronic civil registration and vital statistics systems in 2024, digitalizing various civil events, including birth registration. Kenya introduced a digital birth and death registration system in 2023, generating a unique personal identifier, or what we call Maisha number at birth. South Africa has implemented an online birth registration system in public hospitals. Lesotho launched its digital birth registration system in 2023 as well, but this time integrating it with health facilities. We have seen Ethiopia, which is showing growing momentum for digital reform as well, with Addis Ababa City Administration piloting one-stop service centers focusing on birth registration. Uganda has introduced a mobile vital record system. Cameroon has a new law, 2024, supporting digitalization of CRVS. Right, next slide. As regards emerging technologies and managing systems, common emerging trends include use of mobile applications for remote registration, biometric data for unique identification, blockchain for secure data storage, centralized management and integration, such as systems which are typically managed by national authorities, e.g. the Nigeria's National Population Commission or Kenya Civil Registration Services, increasing focus on integration with health facilities, national ID systems, broader e-government initiatives. Next slide, please. Right, digitalization, in fact, is offering transformative potential for advancing children's rights by ensuring legal identity and facilitating access to essential services. If we go for the legal identity and rights enforcement, a birth certificate provides a child's first legal identity, enabling access to education, healthcare, social services, and legal nationality. It establishes proof of age, protecting children from exploitation, trafficking, child marriage, and child labor, amongst others. Improved coverage and accessibility. Digital tools, especially mobile and remote registration units, can significantly improve coverage in hard-to-reach areas, informal settlements, and for refugee and stateless populations. This reduces geographical distance and travel costs for parents. Efficient governance and planning. Digital systems provide accurate, real-time, and disaggregated data on vital statistics. This data is crucial for government planning, e.g. provision of social amenities, resource allocation, school capacity, teacher deployment, and designing child-focused policies. There is also reduced bureaucracy and cost effectiveness. Digitalization promises faster, easier, and more convenient registration, reducing delays, errors, and bureaucratic hurdles associated with manual paperwork. It also offers cost savings for both citizens and state in long run. As regards child protection, a secure digital record provides proof of age, which helps prevent violation of child rights like child marriage or trafficking, which I said earlier. Next. Despite the benefits, digitalization faces significant systemic and structural barriers as well that can exacerbate exclusion if not addressed intentionally. Low digital literacy and awareness. Significant barrier is the limited digital literacy among certain populations, including rural communities, old caregivers, and marginalized groups. Many parents are unaware of their duty to register a child or the benefits of registration. Legal and policy gaps. These outdated legal frameworks often do not fully support or recognize digital records, electronic signatures, or cross-sectoral interoperability. Legal ambiguities and lack of clear data protection laws create uncertainty and hinder effective implementation. As regards exclusion of marginalized groups, digital systems risk unintentionally exacerbating exclusion for vulnerable populations such as children with disabilities, those in nomadic communities, informal settlements, refugee and stateless populations, undocumented children, and children in street situations. Barriers include lack of required parental documentation, high mobility, distrust of formal institutions, and specific accessibility needs. Next. Data privacy and trust concerns. Ensuring robust data privacy and protection for children's sensitive information is paramount. Public distress due to past controversies or fears of data misuse, surveillance, and identity theft pose major hurdles to acceptance and uptake. Financial and bureaucratic hurdles. Despite claims of cost effectiveness, fees for certificate, late registration penalties, long travel distances, bureaucratic processes can be prohibitive for low-income families. Human resource and coordination issues. Challenges include lack of adequately trained personnel, high staff turnover, and insufficient coordination between health institutions, local administrations, and civil registration offices. As regards limited child participation, children and young people have been rarely directly consulted or involved in the design, implementation, or monitoring of digital birth registration systems. Concerning state parties, there has been also, it has been realized that comprehensive legal and policy reforms there is urgently revise or enact legislation that explicitly supports digital birth registration, recognizing digital records and electronic signatures as legally valid. Policy reform should ensure laws incorporate child-specific data privacy safeguards, aligning with national and international standards like POPIA in South Africa. There is need to harmonize regional laws with federal proclamations and also to eliminate registration fees for birth certificates across all regions. There is need to simplify legal requirements for vulnerable populations, including migrant, refugees, stateless, and undocumented children, and children born out of wedlock. As regards infrastructure investment and accessibility, there is need to invest in and expand digital infrastructure, particularly in rural, remote, and mountainous regions, ensuring reliable.
Honorable Karuna, you have less than 2 minutes.
Really, I'm so sorry. Yes, I'll rush. So there is need to expand mobile registration units. There is need to integrate birth registration into primary healthcare and education system. Or there is also need to design, design for inclusivity. Next slide, please. Yes, there is need for awareness, training, and community engagement. There is need to launch sustained multilingual public awareness campaign. There is need to empower and train local government officials, health workers, and traditional regional leaders. There is need to foster meaningful participation of children and youth in the design of programs. As regards operational and management improvements, there is need to allocate sufficient budgetary provisions for the sustainability and functionality of programs. There is need to implement independent and user-friendly grievance procedures, and there is also a need to ensure accountability of all duty bearers. Next slide, last one, I think. For the African Union and REX, there is need to have continental standard setting. There is need to support capacity building. There is need to ensure there is monitoring and accountability, and also the need for knowledge sharing and advocacy. Okay, thank you. Merci, asante, obrigado, gracias. Thank you so much.
Merci beaucoup, Honorable Karuna. Thank you so much for sharing your insights from the committee's current work in ensuring that birth registration along digitalization and the advantages that come with it, as well as also giving us a cautionary tale of what we need to be mindful of in terms of the emerging challenges from those trends that you shared with us. Thank you so much, Honorable Karuna. Now, our next speaker, ladies and gentlemen, is Mr. William Muhwaba. He's with the UNECA, and he's going to focus on continental initiatives such as APAI, CRVS, and the progress to date. Mr. William, you have 8 minutes. I will give you a reminder when you have less than 2 minutes to go. Over to you, Mr. William.
Okay, thank you so much. Let me ride on existing protocols from my previous speakers, and let me welcome everybody who has joined us. Let me begin by congratulating UNICEF and its partners on the launch of this Eastern and Southern Africa CRVS strategic framework. This is actually a very bold move and much needed step forward that complements and strengthens the regional commitment already embodied in the APAI CRVS program. It builds on the APAI CRVS strategic plan, which actually extends until 2028. It demonstrates UNICEF's leadership in keeping civil registration at the center of development agenda, with a strong focus on children and inclusion. I'll begin by pointing out some of the CRVS continental initiatives, and you can realize by the end how these dovetail into the framework which we are launching today. I think most of you are aware of the APAI CRVS, which is actually called the Africa Program for Accelerated Improvement on CRVS. And this program has actually been running for the last 15 years. I think it's one of the longest running programs in development on the continent. So this is our continental initiative to provide management and programmatic guidance to the regional agenda. So far, under the APAI CRVS program, 46 African countries have managed to actually carry out baseline studies, which we call comprehensive assessments. And out of these, almost 40 African countries have developed their strategic plans on CRVS. Then the second initiative, we have the Conference of Ministers. So our African ministers meet every 2 years to provide policy directives and strategic guidance for CRVS systems in Africa. These conferences are held periodically and bring together ministers of Home Affairs, Interior, Decentralization, Health, and so forth. Then the third initiative which we have is called the CRVS Applied Training and Research Program. And we are actually undertaking this program with our sister REC, which is the ESCAP, the Asia and the Pacific, as we realized that the issues which have to do with CRVS on the African continent are also the same issues in Asia and the Pacific. So this is an initiative that focuses on research. And if you recall from what the Honorable was actually saying, she gave a host of all the issues which affect CRVS, but the way they play out at country level tend to differ. So what we have now done is to zero in out of all those, which ones affect country A, country B, and country C. So this CRVS or CAT program is actually aimed at that. Then the fourth program which we have on the continent is the African eCRVS Shared Asset, which we call the AXA. It is a continental initiative that represents our collaboration on the African continent to actually address this issue of digitalization. As also the previous speaker highlighted, there are a whole host of problems affecting digitalization. So we are actually addressing it by looking at those and designing a common approach. So AXA is a continental initiative that is designed to enhance CRVS digitalization through shared resources, technical standardization, and strategic partnership. We realize that some African countries cannot afford to purchase their own digital solutions. So we are actually coming up with a common applications which will be cost effective, will be free to all the 54 member states or 55 according to the AU. So as you can see, as we speak today, I want to encourage you to use this framework because it is backed by some of these initiatives which I have actually mentioned above. It provides a regional structure through which our individual contributions can be aligned. And as the previous speakers have actually indicated, the three pillars which will get us where we want are
You have 2
digitalization,
minutes, Mr. William. You have 2 minutes, less than 2 minutes.
decentralization, interoperability, and so forth. So, in order to sort of summarize, let me appeal to our development partners. In our circles, we call them the Africa Sierra VS Core Group, that at this point, none of this can be delivered by one actor alone. Partnership is important, and we should go into it as a shared vision. So let me close by saying, let us use this framework not just as a reference document, but as a rallying point for concrete, coordinated action in increasing vital events registration as we endeavor to attain SDG 16.9. The opportunity is here, the urgency is real, and the responsibility is ours together. We need to address the scandal of invisibility in Africa by making sure every child is registered. Thank you. Over to you, Chair.
Thank you so much, Mr. Muwava. Thank you for sharing those lessons and the available existing evidence and research, as well as initiatives that UNECA is currently working on. Initiatives that those of us working in this space can build upon, as you rightfully put it. Thank you so much. Now over to our next speaker, Taju Mohammed, who is the head of Civil Registration Service Directorate in Ethiopia. Salam now, Taju, and over to you. I don't know if you're speaking, Taju. I cannot hear you.
Okay, thank you. Are you hearing me?
Yes, yes, yes. Please proceed.
Thank you very much. Good
I will
afternoon.
send you, I'll just give you a gentle reminder when you have 2 minutes so that you can start winding down. Over to you, Ato Taju.
Okay. Thank you very much for all of you. Really, it is a good opportunity for us as Ethiopia. Let me highlight you some points of civil registration in Ethiopia for the last 9 to 8 years. When I come to my presentation, to the next slide, my sister. Hello?
Yes, I think we have someone who's assisting us. He's requesting that we move to the next slide, please.
Just from the outline, I wanted to say some points about the Ethiopia and the overview of civil registration system in Ethiopia for the last 8 years, and the current status of birth registration in Ethiopia, the issue of decentralization, interoperability and digitalization, and the government's initiatives concerning the legal framework of the civil registration. Next slide. Thank you. As you know, civil registration is somewhat difficult for countries like Ethiopia with highly populous population. Almost it is the second country in Africa next to Nigeria. We have federal structures with 12 autonomous regional states and 2 city administrations. From the civil registration point of view, we have around 19 and 202 district administrative district areas in which we are conducting civil registrations.
Honorable
know, Ethiopia
Kaluna,
is
please. Honorable Kaluna, please mute your mic. Sorry, Ato. Ato Taju, you can continue.
okay. As you know, Ethiopia is with large refuge populations. So in order to address these problems, we have to consider another issues. Next slide, please. When you see the history of civil registration system in Ethiopia, our legal policy framework was enacted in 2012. Then finally, because of the different legal and institutional barriers, we amended in 2017, expanding the scope of civil registration for non-nationals and the refugees, for the pastoralists, which were not properly considered in the previous proclamation. Now, in this year, already we ratified the latest proclamation, which is includes civil and family registration with a proclamation number of 1370. Then, based on this proclamation, we revised different barriers, legal issues, institutional barriers. Then, as you know, currently Ethiopia is conducting civil registration in a decentralized structure base. Ethiopia's civil birth registration rate was very low. It is almost more than 3%, less than 3%, particularly for children under 5 years, according to the Ethiopian Demographic and Health Survey, which was conducted in 2016. Actually, this year we are expecting is a Demographic and Health Service, Health Survey preliminary report, which is expected to be disseminated for the different stakeholders in the next September 2025. Concerning the refugees and nationalists, we were started in October 2017. Next slide, please. As you see from this graph, it indicates some progress in birth registration, and when you see the progress of newborn registration rate by region, by the region we have, as you have seen, Addis Ababa, the capital city of the country, Oromia regional state, Sidama regional state are relatively better than the other regions because of the reason they started one-stopping service, which is located in health facilities in the regions. Now, by the next year, we are going to launch in all government health facilities to start one-stop service registration, which is going to be integrated with mother and the children health services, with vaccinations and others. Next slide. Concerning the decentralization of CRVS, we have different governmental structures at the grassroots level. We have district cabales. Then at national level, immigration and citizenship service, in which I am working or have a role of leading, coordinating and supporting and monitoring civil registration system in all regions at national levels. And we have the registration of in our embassies and the consulates in different countries for the Ethiopians, with different stakeholders like Kabale and Warada zone and the regional level. Almost the reporting system will follow through different steps by paper-based civil registrations. So there is a number of challenges that we have seen by the National Comprehensive Assessment, which were conducted almost 2 years ago. Second slide, please. Look, our civil registration channel looks like this, from the grassroots area up to the national level, then we will transfer our report for the Ethiopian Statistical Ethiopian Statistics Service. We have regional.
Ato Taju, you have less than
Yes.
2 minutes. You have less than 2 minutes. Please start wrapping up.
Okay, go to the next slide. Interoperability, concerning the interoperability, already we are going to start one-stopping shop registration. Currently, we are registering in 674 health facilities, which to handle the after-birth registration with immunization. Let me go to the legal reform, which is currently conducted. Next slide. Concerning digitalization, we have different practices in the last 3 years. Mobile civil registration, mobile Ethiopia civil registration, which is piloted in 1,300 registration sites. We have another civil registration system, which is homegrown and developed at national level, that we are going to make standardized through the whole country. Next slide. With the legal reform, we introduced different issues which were a barrier. For example, like a place of occurrence. Now we can register registration in place of occurrence as well as in health facilities, and also we don't have any payment for the current registration in the new legal proclamations, and also we have a backlog clearance for the refugees. So and so on. And also there is a different registration sites in health facilities, at Warada court level, and so on. Second slide. Now we are going to forward the following issues to accelerate the progress. The first one is implementation of standardized national digital CRV system throughout the country. Second is strengthening the interoperability with multi-sectoral coordination, for example, with national ID, with healthy facilities, with education sectors, to accommodate it with the other services. And again, we are going to enhance public awareness, and demand creation issue is also the other option. The last and very difficulty for my country is the issue of resource mobilization, because it's a country with highly populated population. So we are going to mobilize our resources with our partnerships and as well as from the government budget. Thank you very much.
Amasegnalo, Ato Taju, thank you so much for that. Without further ado, I'd like to introduce our next speaker from Mozambique, Dr. Arnaldo Jamal, the National Director for the National Directorate of Civil Registration and Notary. Over to you, Arnaldo. When you have 6 minutes, when you've gone through 6 minutes and you're left with 2 minutes, I'll send you a reminder to start wrapping up and close off your intervention. Over to you, Dr. Arnaldo.
Thank you. First of all, I would like to thank the UNICEF to offer this opportunity to give the strength civil registration Mozambique towards the realization of the regional and global commitments. Let me tell the background of CRSV and the legal identity. Next slides, please. The main objective of the SDG is to ensure that by 2030, all men and women have equal rights, particularly the poorest and the most vulnerable, to access economic resource and basic services. Registration is a condition for acquiring this right, and it's through registration that nationalities are recognized, and consequently, access to the basic rights offered by the state, such as health, education, and social assistance. The Republic of Mozambique grants nationally based on the criteria of consanguinity, territoriality, marriage, and naturalization. Next, the situation in Mozambique. The Republic of Mozambique was one of the first countries to carry out a comprehensive evaluation of the APA CRVs in 2030, in line with the API CRVS strategy. Following the assessment, several recommendations were made to strengthen the system in the country. The current under 5 birth registration rate in Mozambique is 22%, according to 2023 DHS. In accordance with the provision of the Constitution, Mozambique's commitment to the national commitment, both in convention in regional and international strategies over the last 20 years in Mozambique, has undertaken the following initiative to strengthen the CRVS in Mozambique and guarantee the civil registration of the population. Legal reform. The Republic of Mozambique introduced the pilot registration of the CRVS system, and which introduced the unique citizen identification number through Decree number 44, 2010 of 2 November, which allows children to obtain birth certificates anywhere in the country. Law 12, 2008 of 4 December established the electronic civil registration system, the digitalization of the system, the authorization of interoperability with the health system, and introducing the GTV. Through the GTV, the country has developed a 10-year strategy plan, a CIRSERV, and a surveillance operational plan with the aim of achievement an 80% birth registration rate for children under 5. CRVS is a web-based system in general, with some functionality in USSD technology. It can be accessed from anywhere in the country via the internet, and the offline model has already been launched in the experimental phase. To further improve access in security areas, the country is trailing the implementation of an offline birth registration model. The digitalization CRV system, digitalization and interoperability with health. Following the introduction in the digitalization pilot in 2017, all 68 CRVS conservatories are now digitalized in the country. In addition to the digitalization process, in order to promote system interoperability between CRVS and health, the country has opened the 150 CRVS posts in hospital by December 2024. The opening of CRVS posts is helped to improve access to CRVS service for children and their families, especially mothers. The institutional birth rate in Mozambique is over 7%. The CRV access for hard-to-reach areas and vulnerable population. Mozambique is facing several humanitarian crises, including conflicts and climate disasters. To ensure that all vulnerable population have access to birth registration service, the government has implemented several initiatives over the years. The conflict in the north of the country has resulted in the emergence of approximately 850,000 internally displaced persons, and most of them have lost their identity documents. In response, the government, in collaboration with partners such as UNICEF, EOM, and the World Bank, has facilitated the retroactive birth registration, targeting both us most in the IDPs. Mozambique, through a directive, facilitated access to birth registration, reconstruction for
You
interred.
have less than 2 minutes, Dr. Arnaldo. Please start wrapping up. Thank you.
Thank you. Displayed to ensure that they could recover their documents in a timely manner. Since the start of the terrorist attack in the north, more than 145 EDPS have been registered. The recurring cyclone have not only resulted in the loss of legally documents, but also the destruction of historical registration documents. The government, in collaboration with development partners, also responded through retroactive birth registration as part of the emergency response. Mobile birth registration campaigns were also organized, target children at risk of early marriage. The key of success factor driving growth trajectory: birth notification by SMS, installation of birth registration cert in hospital, and interoperability with the health information system. Provision of mobile registration brigades and integrated campaigns to register births and issue identification documents. Social mobilization campaigns to encourage adherence to birth registration. The current challenge, although the government of Mozambique is still committed to meeting SDG target 16.9 of achieving 100% registration by 2010, the country still faces several challenges, including digitalization of historical registration documents, challenge in identification effective means of registration deaths and cause of death in the communities. Rehabilitation of the CRV's physical infrastructure destroyed by conflict and cyclones. Next slide, please.
You need to wrap up, Dr. Arnaldo. I'm giving you 30 seconds.
Thank you, Zabel. Look into the future, we are continuing to implement interoperability with the national health system, interoperability with identity issue systems, development of the offline registration model. Next slide, please. Thank you. Asante sana, merci, obrigado, and thank you for hearing me.
Obrigado. I don't know if it's obrigado to you or obrigada, but thank you so much. Thank you for
Obrigado,
sharing.
thank you.
Yeah, thank you for sharing insights from Mozambique, and we note with appreciation the efforts that you're implementing in your country with CRSV. And over to our next speaker, Patricia Angelo Mpuya, the Registration Manager for Registration, Insolvency and Trusteeship Agency from Tanzania. Over to you, Patricia.
Yes, thank you very much, and a very good afternoon to everyone. Thank you for this opportunity. I'll be presenting on the Universal Birth Registration, a gateway to rights and development. I'll be linking our Tanzanians' experience in relation to the UNICEF strategic program framework for strengthening CRVS in East and Central and Southern Africa. Next slide, please. Next slide, please. Yes. I'll in my introduction, next slide. I've explained about the scandal of invisibility, that being a major challenge in most of the Eastern and Southern African countries, including Tanzania, that children are being born, but most of them are not registered. And if registered, then it's not timely. So the impact of this not registering children is denied legal rights, also denied access to essential services like health, education, but also it increased risk of child marriage, labor trafficking, and statelessness. The goal is to ensure now that universal birth registration, all children have access to be registered timely and be recognized under the law, and so as be able to access different essential services. Next slide, please. Well, going through the framework, I thank UNICEF for their endless support to ensure that all the children are recognized, be given their first and foremost right of being registered and being issued with a birth certificate. And narrowing it down now, next slide, to the framework itself, it has got 3 accelerators, that is interoperability, decentralization, and digitalization. So linking it with the progress that we've made in Tanzania. Next slide, please. A case study in applying the framework, Tanzania's case study. Tanzania exemplifies the successful application of this framework. One being the decentralization. We've managed to expand services to reach undeserved populations, embedding birth registration services in maternity and RCH wards, ensuring mothers not to travel, exclusive for availing birth services, no additional indirect cost. So once a child is born in the health facility, can be registered there and then and being issued with a birth certificate. But if for some reason is being born at home, then can be registered at the ward level. So you can see the decentralization mode that we've adopted. Also, we have managed, under decentralization, we've managed to develop the guidelines to facilitate registration of minority groups, registration of young and adolescent mothers, people at the border regions, because our laws recognizes registration of every event in Tanzania mainland has to be registered regardless of their parents' nationality or citizenship. And we've managed to shift the centralized to the centralized system and increase registration points from 139 in 2002 in 2012 to over 12,000 registration points in 2025. So you can see that we have managed to make the access, more people can access these services at the local level. Now, another progress that we've made in relation to digitization and interoperability, we have managed to enhance our infrastructure through the creation of single digital platform to register all vital events, birth, death, marriages, divorce, and adoption. We have got the e-RITA system now. It's an online system whereby citizens can access it and make application of the birth or death certificates. We've also integrated our CRVS system with the national identity and NIDA, national, also immigration, the health insurance, National Health Insurance Fund, public social services. So as you can see there, we've managed to integrate and we now share the information and reduce the cost of double registration that a citizen can be required to do that. Also, we have been pioneering the using of mobile technology. We use the mobile phones to enter data in our database. When the children are registered at the health facility or at the ward level, the data then transferred to our database using the mobile phones. And these mobile phones are being given to all the registration centers. And this enables us to get the real-time data and also have the data readily available for planning purposes. Also, we have managed to waive the fees for the children under 5 for the first issuance of the birth certificate. Next slide, please.
You have less than 2 minutes, Patricia.
Yes.
Pole sana.
Asante, now starting wrapping up. The outcomes, as I've said, we've managed to increase the registration rate of the under 5 from the 10 to 12% in 2012 to over 68% in 2025. So you can see the certification rate has increased tremendously. And yes, next slide, please. Next slide. Yes, there are challenges, as I've mentioned. Reaching out to older children is one of the challenges, but also community awareness. We still have to do the public awareness so that people can be proactive in ensuring that when the child is born, they register their children right there and the birth certificate is being issued. So in conclusion, I would like to thank UNICEF for their endless support, for ensuring that birth registration is not just about a piece of paper, but it is identity protection and opportunity for the child. And what Tanzania has done demonstrate the transformative power of the strategies when coupled with strong government commitment and partnership. I would like to thank you for listening. Asante sana. Shukran.
Asante sana, Patricia. Thank you so much. Without further ado, I think now we will progress to an intervention by Nakali, the Regional Advisor of Child Protection, UNICEF ISARO. Nakali, a colleague, a partner, we've done a lot of work or some work with ACPF, so it's happy to see you in this platform again. Nakali, you have 8 minutes. Over to you. I'll remind you when you have 6, but I'll give you grace. Maybe I might give you an additional 1 minute. Over to you, Nakali.
Thank you so much, Isabel. All protocols observed. And Isabel, I'm coming in and trying not to feel any pressure with your timekeeping, but I know that we want to ensure that everybody gets a chance to ask us questions, and so I will be conscious of that. Colleagues, thank you so much to everyone. We had, I think at peak, over 107 participants on this call, which is really excellent to see as we launch our new strategic program framework for strengthening CRVS for UNICEF, focused particularly in the East and Southern Africa region. Next slide, please. Now, why this framework and why now? Over this year, we've had the great fortune within UNICEF, we have a data team who are actually responsible for reporting against the SDGs, who highlighted to us how Africa is performing in terms of birth registration, and particularly how our region, East and Southern Africa, is performing. So what we know, and some of the other presenters have already shown, is just 51% of children under 5 are registered at birth in Africa. Over 110 million children have no legal proof of evidence. And nearly 90 million children have never been registered. And where the burden is most felt across the African continent is within this region of East and Southern Africa. And so together as a team, I think Isabel did a great job of introducing me as a Child Protection Regional Advisor, but just to say for us within UNICEF, this is not just the business of child protection. It ranges with education, with health, with the planning teams. All of us came together to be able to develop this framework together with our partners so that we can be able to shift the agenda and move the needle for this particular region. Next slide, please. Now, in working with our partners at government level, at civil society, we came up with a joint vision. And for us, it's that by 2030, every child in East and Southern Africa is registered at birth and has legal identity. Why 2030? That aligns with global goals. We do know that as an African continent, we have our Agenda 2063, but we want to be ahead of that. We want in the next 5 years to be able to register all children and recognize them within the continent. The goal is to reach 95% of birth registration coverage across the region by 2030. And for us, This is not just about numbers, even though, of course, numbers plays a huge role in this. It's about ensuring that children are not invisible. We keep talking about a continent where majority of the population is going to be, and particularly young population, but we need to know and recognize them by ensuring that as every young person is born in this region and across the continent, they are registered and they have a birth certificate at hand. Next slide, please. Now, the three core strategies, following the vision that we had in mind, I'm really happy to have heard the different presentations by government representatives, all across, from Ethiopia, from Mozambique. We also had from the different representatives that in Nigeria, in Uganda, etc., across the continent, all of us are coming together around three core strategies, and these are evidence-informed strategies. Number one is around interoperability. As I started off to say, we want to ensure that this is not just a system within protection, but we want to ensure that all systems can be able to connect, whether it's health, whether it's education, protection, and increasingly on the continent is to ensure that our national ID systems are also able to connect in a way that we're able to identify who is born, where they're born, where their parents are from, etc. And the great news for us as a region is that we already have countries who are making progress in this way. Rwanda, Namibia, South Africa are all showing that this is possible and that it works. And so the challenge for those countries who haven't made that connection in terms of interoperability is what can we learn from those countries and what can we scale up so that it really becomes, a region-wide initiative. Decentralization. We know that, most of the challenge about the services that we have is ensuring that they're as close as possible to families, and especially in rural and underserved communities. I know there's one person who posted a question, and thank you so much, Brenda. I recognize that, talking about children institutions. Children who are sitting in institutions and don't have parents, how do they register? Again, for me, this goes back to decentralizing those services. We need to bring those services as close as possible, where there are families, where you don't have families, but anywhere where you have a child. We want to ensure that those services are there, that the community knows about them, and they can be able to ensure to use them so that children can be able to recognize their rights. Digitalization has been, a key theme that has come up over and over again. It presents such a huge opportunity for us, not just in this region, but as a continent at large. We need to be able to take advantage of what digitalization brings for us in terms of really scaling up birth registration on the continent. And I really appreciate the presentation that was done by the African Committee, just looking at the progress across the continent, not just in this region, in terms of how governments are taking advantage of digitalization. But what we also know, Isabel, and many other, many of the other people who are online, is that it also comes with challenges. We need to be careful that we are using the right forms of digitalization. We need to ensure that we have the right vendors who are coming in to support our countries. So as it provides opportunities, we also need to be able to have the right knowledge and skills to know which type of digitalization is best to be adopted in the different country contexts that we're in. And Namibia is one country in our region that's really making progress in this way. Next slide, please. Now, supporting interventions, and many colleagues have already spoken to that. I'm going to go through this quickly because I can feel that pressure of Isabel on me as I'm presenting.
I'll give you one extra minute. I'll give you one extra minute.
Thank you, thank you. So again, in discussing, and we're really consultative in terms of the way that we develop this strategy, one of the key and top supporting interventions that came to the fore is the issue of legal and policy reform. In most of our countries, not just in this region, but across the continent, we have laws that are in place. Our challenge is that our laws are outdated and they're not modern. They're not responding to the current context that we're in as Africa. And so in many of our countries, all those, the three core strategies, whether it's interoperability, decentralization, etc., those will not be achieved unless we have the right laws and policies in place. And so that's something that we're really kind of working towards and supporting countries to be able to address. Next slide, please. The other issue, and I think the last presenter just made reference to that as well, is the issue of resource mobilization and domestic financing. This one, I think, for me is particularly important, especially in the year that we're in, where we're facing a huge, significant hit across the continent, in this region, and almost in all countries. We've had our donors walk away, And so we're having to look at, what kind of resources we have in country. We're having to prioritize. And I know a lot of our governments are reprioritizing their budgets. And so the advocacy colleagues that I hope that we can all walk away with from this webinar is how do we all come together and make a case for investment in this area? Indeed, governments are having to prioritize many different areas, but this is one which for me, I think is also particularly key. This is the first right of any child. If a child is born, you need to recognize them, you need to see them. And if we don't have systems that are able to know that they're there, to be able to use that, to recognize their rights, then we're not going to be able to make progress as a continent. Next slide, please. And I think this is probably the last one in terms of supporting interventions is partnerships. The numbers that I shared up front, colleagues, are just huge. Over 110 million children have no legal proof. Just 51% of children under 5 are registered at birth. That shows, almost half of the children who are born on the continent, and who are under 5, were not registered. It's not possible for any of us individually or any country individually to be able to make progress in this area. We need to be able to come together, whether it's with governments, with civil society. It's been great that we've had a range of people on the panel. It needs all of that and 100 times more for us to be able to really make a dent on this in the continent and even more so within this region. So colleagues, partnerships is really going to be upfront and central in order for us to be able to deliver on the vision for this strategy. Next slide, please. Social and behavior change, we need communities that demand and ask for this registration to be able to happen. Especially in rural areas. We want to be able to be, a community or a society that recognizes the importance of this right for children and to demand it. So that when those communities are sitting and, this picture, I think for me speaks a lot. It shows communities who are in kind of hard to reach areas. They need to be demanding these services and we need to be responding to them. We need to ensure that we don't leave anyone behind. We will not achieve that 95% rate that we're talking about unless we're not only able to reach those in our cities, but also those in hard to reach areas. And so being able to build up that demand for the services, I think will be really important as we go forward. Next slide, please. And Isabel, I just have 3 more slides. So in terms of the final supporting interventions is capacity development. We know that we need to continue to build systems that can be able to respond. We're not going to address those 3, strategies that we're talking about unless we're able to build capacity to be able to have that interoperability, to have the digitalization that we're talking about. We need to ensure, but perhaps maybe even number 1 is having enough CRVS personnel who are around, who can be able to do this work. And then what capacity do they have to be able to deliver it is really going to be key. And so continuously building capacity is important for us as we go forward, especially in a continent like ours where, a majority of children are born on an annual basis globally. Next slide, please. And so the call to action, as I finish off this, is, we're calling on different players. As we've said, we need different partners to be able to come around the table to deliver on the vision that we have within this strategy. For governments, we're calling on your leadership to invest, to track data completeness, accuracy and timeliness when integrating vital statistics into national development strategies. If this issue is not a part of national development strategies, it's not a priority for us as a continent. And I don't believe that we come from and exist and work in a continent that doesn't think that children are a priority. And you can only show that by ensuring that the issue is integrated into our national development strategies. With partners more broadly, we need to advocate for annual CRVS performance reviews. We need to know if we're going in the right direction. And so just kind of pushing on and plugging on with those strategies is important. But I think it was William who was talking about there will be differentiation across different countries, and we need to know about that. And the annual performance reviews will really show us that. And finally, for communities at large, is just stepping up and helping us to drive awareness and accountability and uptake. We need to be able to ensure that as far as possible across the continent, and then particularly in our region in East and Southern Africa, that everybody knows and demands this service so that we can really be able to make a change for the continent and for the children that we have on the continent, and more especially in this slide. Last slide, please. And so thank you very much, colleagues. I really appreciate everybody who's made the time to be able to join us today, to be able to hear about this framework and to ask us questions. We're carrying on to ask those questions, and Isabel, of course, will lead us through that. But from my side, it's just to really appreciate people who've made the time to be here with us today, to hear about this framework, and looking forward to all of you joining us in its implementation. Thanks so much, Isabel. Back to you.
Thank you so much, Nankali. Thank you so much. I'm glad you managed to fit it all in and given us a synopsis of what the framework is, what you're aiming to achieve, and what you're hoping partners can join part of this engagement and take the chalice forward. So one of the key things as we go into the questions section, just a reminder, first of all, please type your questions in the Q&A section. Target your questions. Please tell us who you would like your question to be responded to by. So as we do that, I just want to highlight and emphasize a key statistic that came from your presentation, Nankali. You said 110 million children have no proof of legal registration. And previously, we heard from Ato Taju about how populous Ethiopia is. 110 children is almost the size of Ethiopia alone, of people that we don't know, people that are stateless, possibly stateless, or at the risk of statelessness. So that's how huge this issue is. And I would also like to emphasize what you said, Nankali, about how do we make a case for investment in this area. And I'm glad Honorable Karuna is here because 2025 is, in terms of the theme for the Day of the African Child is investing in children. So I'm glad investing also came out in your presentation, Nankali, because we can identify solutions, but those solutions need money. And we know the sort of challenges that we're facing with the funding space. So how do we make sure that our duty bearers prioritize this issue? Where they put money where their mouth is, and this is one of the issues that we need them to invest in. So without further ado, I'm going to go into the sections and to the questions. Sorry, I think you responded to Brenda. Do you need more time to actually engage with Brenda's question, Nankali?
No, I think I'm good. I've shared, but unless you want me to repeat what I typed in.
Possibly, yes, for those that would like to hear it just quickly, and then we move on to the next section, and then maybe Honorable Karuna can also respond if she has something to say.
Okay, thanks so much, Isabel. Colleagues, Brenda's question was really about how do we reach, and I think I made reference to it, Isabel, also when doing the presentation. She was talking about how to reach children who are in institutions. And for me, the important point there was this issue that we're raising around decentralization and really ensuring that we reach those who are in the hard to reach areas or those who are not, in a home, in a family setting, etc. And I think a lot of countries are making progress in that sense, but we need to do more, obviously. I think, from probably even just from, not even just from COVID, but we're always thinking about the COVID time where things completely changed, and we need to see how we have systems that are not centralized in one area where people have to move towards them, but how we reach out. And part of that reaching out for me is decentralizing these services, taking away the costs that are related to them, and ensuring that children who are in hard to reach areas like institutions can be reached by registration services. So for me, decentralization is core in responding to that. Thank you.
Thank you so much, Nankali. Honorable Karuna, we know the committee, the African Committee of Experts has got a general comment on children without parental care. Do you want to, in 30 seconds, Honorable Karuna, we're running out of time. Do you want to say something in response to Brenda's question about how, if there are any provisions or recommendations in the framework for African member states who are faced by children without parental care? I mean, above and beyond what UNICEF is doing, could you also give a brief a statement on what the committee is doing? Because I think more than ever now, what's important is for us to join efforts and collectively work together and to avoid duplication of efforts. So where there are synergies, we continue to strengthen those synergies. Over to you, Honorable Karuna.
Thank you very much, Isabel. Honorable Karuna had to step out. I think she had informed the organizers. I am from the Secretariat, but I just would like to say one point and quickly, which is highlighted under General Comment 6 of the committee, which I invite the audience to refer to in terms of state obligation and the nature of rights of birth registration and nationality. And one of the key things I would like to highlight is the call of the committee to ease restrictions in bureaucratic processes in terms of registration requirements, such as the requirement of proving parents' identity or the requirement of both parents being available, or the requirement of, at least even when both parents are not available, that additional legal guardians or persons who are interested with the care of the child should be able to register the child. So this flexibility is something that the committee and the General Comment also advocate for. So I just wanted to quickly make that point. Thank you very much.
Thank you so much. It's Samrawit, right?
Yes, thank you,
Thank
Isabel.
you, thank you, thank you. Okay, the next question is from Betsy Wanjala from Open University of Kenya. Her question is to Honorable William Moana. To what extent does UNICEF work with institutions of higher learning, universities, to establish the number of teenagers with children in urban slums and rural settings in order to address registration issues, both registration and child vulnerability mapping, in order to address children's issues from unit level rather than aggregates? I want to believe that it is easier to work with whole numbers instead of percentages. These institutions have research as one of their core mandates. Mr. William, could you respond to that question in 1 minute? I'm so sorry for the pressure. We're running out of time.
Isabel, William has just had to step out and he's going to write to Betsy immediately after this web.
Fantastic. Thank you so much. And there's another question from Suleiman from Zanzibar. He listened to Mr. I think, again, this goes to William. So I think William will respond to these speakers, presenters. Oh, the next question is for you, Ato Taju. What is the current rate of birth registration and death registration in Ethiopia? From CRVS, what actions have been taken so far to improve causes of death registration? Ato Taju?
Yes.
1 minute.
Our current coverage is around 48%. Birth registration is around 48%. Death registration is not more than 20%. What was the second question?
What is the current rate of birth and death registration, or what actions have been taken so far to improve causes of death registration? I think birth registration. The question is not clear in that regard.
Maybe if it is the issue of cause of death, to improve the data related with cause of death. In new proclamation, it is there is some article that enforces any citizen to inform the death for the policeman.
Okay.
So
thank you, sir.
anyhow, it needs somewhat a community awareness with the religions, and so.
Amasegnalo Ato Taju. And then Konjit is asking, what is the experience of an alternative of birth notifications provided by health center or hospital, as the cost of printing of the notification and distribution is becoming expensive? Nankali, would you want to address that?
I actually see a colleague of mine, Brenda.
Oh,
I see
okay.
that you're busy asking. I think she's answered to, and so I'm asking her to come in. And I mean, Gloria, excuse me.
No problem.
Gloria, are you there? No, she's not there.
Okay.
All right, we'll provide a written response. Thanks.
Okay, thank you. Has anybody responded to Lucy Aguaya's question from University of Kenya? It's to Mr. Ekesa. Mr. Ekesa, have you responded to her?
Not yet, but I think her question is about how do we reach the hard-to-reach children in the settlements and in the slums where there's no electricity. She's talking about digitalization. And I think, as I said, if you looked at the issue of digitalization, I know Nankali has spoken about it, but I think the main thing is to ensure that every child is reached, is not left out. And that's why is one of the key monitoring tools we use at the committee to ensure that every country has got effective systems designed and legal frameworks to support the universal access of registration of all children and continued. So for me, I'm thinking that that's an area, it's a challenge for Africa, but it is something which we are saying that we need to work on it to ensure that we're able to digitally reach all our children. Thank you.
Yeah. Okay, thank you so much. And I think there's been an update on the preparations for the next interministerial meeting, as this platform has been very useful from policy level and technical level exchanges. So I think there's a meeting, a conference of ministers meeting planned before the end of the year. And I know there were questions around addressing some of the challenges faced by children with disabilities. And I think some of our presenters highlighted how marginalized communities, governments are making efforts in order to also cater specifically to marginalized communities. So I know in Mozambique, we heard that those affected by conflict, internally displaced individuals, the government is working with UNICEF. It's the same that we're also hearing from Tanzania. So I think in terms of that, we have we have a lot in terms of the interventions that are targeting those groups that are often excluded. But I think in order for me not to leave anyone left behind, I'll give Nankali 30 seconds so that I can also wrap up to address anything that I might have missed from the Q&A. And then we call it a day, and we officially end the webinar. Over to you, Nankali.
Just to say thank you so much, Isabel. I found it striking. There were a lot of questions around children with disability, and so it's something that we're taking away with us to look at how we can be able to share the knowledge of how to build systems that are inclusive for birth registration. Of course, we've got the strategies. We want to ensure that we have, a universal design that can be able to reach everyone, and so. Great note to us as something we really need to be able to watch out for, share more experience on. But other than that, colleagues, just to say thank you so much. I think, Isabel, for me, the issue of inclusive systems has really come to the fore through the Q&A. Thank you.
Fantastic. Thank you so much. Thank you to my wonderful panelists. I think you've given us a lot to take with us, a lot to reflect on in terms of our work. So thank you so much to all my panelists. I would like to also extend a note of appreciation to the organizers who put together this webinar for us to be here. Thank you to everyone. Without further ado, with the powers vested in me, I declare this webinar closed. Please take the conversations forward. This is, we were building on work, and let us continue to work together. Let us continue to find spaces within areas within which we work to take the chalice forward and continue to advocate for improved birth registration systems. Thank you to UNICEF, thank you to CHIP, and thank you to everybody who made sure that this webinar was a success. With that, it's a goodbye from me from Harare. Thank you so much, everyone. Good afternoon.
Thanks to you, Isabel.
Thank you so much.
Thank you.
Thank you.